muscle, and this muscle is obviously taking in food from your consumption. It is also taking in oxygen, which has your lungs would have brought into the system, and combustion is now taking place inside this muscle. As combustion takes place, 98% of the oxygen that is consumed by the muscle will form volatile oxidants, and that is your carbon dioxide. And your carbon dioxide will be eliminated by your lungs. But about 2% will form superoxide, as I showed it a while ago. And these are non-volatile oxidants. You can't breathe these out. These are extremely toxic. And your cells have these vesicles that stores them. And you have the cells have the capability of storing around 10 years production of these free radicals. But after 10 years, you'd have used up all your capacity, and therefore these very toxic compounds will start leaching out, and it obviously will result in diseases. So the body has to have a system to remove these superoxides or these free radicals, and that is how dismutation and disposal would work. So by converting the superoxides into, say, hydrogen peroxide, we can transport it and dispose it from our bodies. Now, although I mentioned it's 2% of the oxygen that forms superoxide, in a disease state, it can increase from 2% even up to 5%. All right, so when one looks at water, what do you find? Water is a very complex compound. And when I say water, I'm talking about natural water. Natural water has about 600 different particles in microgram levels. These include what we call dissolved particles and suspended particles. Dissolved particles will be like your salt. You'll find magnesium, calcium, sodium, potassium. These are easily dissolved in the water. But then there are some other particles we call nanoparticles that are suspended in the water. Now, medical science does not think these particles are important, and we ignore them. When we are analyzing water, we are only interested in the bacterial count of the water and the toxic metals that are in the water. So no concern is really given to these dissolved particles and suspended particles. But when you go into chemistry, and if you do a major in chemistry, one of the things you study is these particles that are in the water, because we use them a lot in the chemistry industries to remove oxidants, especially when you're having various chemical processes going on. Now, these particles, when you analyze them and see how they distribute in the body, they are distributed in a pattern to boost the dismutation system. In other words, helping your body to remove oxidants. And this is a little outline of what happens. So we're back again to our muscle. And this muscle, as we said before, is accumulating free radicals as a result of combustion. Now, there are particles in water which plays the role to mobilize these free radicals and move them into two compartments. One in what we call the adipose tissue, or your fatty tissue, and also to move them in the spaces between the cells. Now, these particles will move the free radicals in various ways. In the case of the adipose tissue, the nanoparticles that are in water will set up what we call a semiconductor system, or an electrical system, like an electrical wire system, and quickly transport these particles into the adipose tissue, so prevent them from causing any damage during the transportation process. While in the interstitial space, there are another set of particles coming from water that encloses these free radicals and prevent them from reacting, so as they wouldn't cause any damage as we move them from the tissue into the interstitial space. Now, after moving to these spaces, there are particles again that comes from water that does the dismutation process. In other words, converts the toxic free radicals into hydrogen peroxide, which you see here. So that hydrogen peroxide now ends up in your blood. After reaching the blood, the hydrogen peroxide is disposed through three main systems: a system in the liver, a system in the kidney, and a system in the intestine. And again, there are particles in water that plays a vital role in this process. In the case of the liver, these particles help the liver to use the oxidant in the hydrogen peroxide and use it to make a product called ribose. In the kidney is very interesting because not only does it remove the hydrogen peroxide and convert it into water, but the kidney is designed to use these same oxidants to kill viruses that may find themselves in our blood. Again, there are particles in the intestine that helps to convert the hydrogen peroxide in a form so the bacteria can consume them and use them in their metabolic processes. So as you can see, there's a lot of particles involved, both in transporting the free radicals into various areas for them to be converted into hydrogen peroxide, and then there are particles again in water that is ensuring that you dispose of these free radicals in a proper way. All right, so why does free radical cause damage? Let's just examine a little more. As I said to you before, these particles are very toxic, and the free radicals quickly react with certain structures in your tissues. For instance, they will damage your protein molecules. Protein, as we know, make up the structure of the tissues and the enzymes, and therefore, if they are damaged, then obviously you're going to get disease process taking place. Damaged protein leads to organ and enzymes dysfunction. So let us say you have your cells in your blood vessels, and there are free radicals there. The free radicals are, if exposed to the protein in your blood vessel wall, will damage those proteins, and those protein becomes very stiff. So because the protein becomes very stiff, when the heart beats, instead of your pressure, the blood vessels are able to vary your pressure and keep your pressure controlled. Your pressure now begins to increase, and you're now diagnosed in a few years as having hypertension. So the free radicals is what is causing the hypertensive disorder in the blood vessels. Free radicals will also travel and damage your nucleic acid in your genes. Now your genes, as you know, regulate your cell. It tells your cell how fast it must grow, when it should divide, and so on. So if the free radicals damage the genes or the nucleic acid, it can cause the regulation of the cell to be lost, and as a result, the cell might be growing much faster than it should, and that is what cancer is. In other words, you have lost the regulation of your cell. Free radicals also interfere with the function of your white blood cell. We all know white blood cell. We spoke about that in last week, about white blood cell playing a role in infection and controlling cancer. So if your white blood cell have a problem free radicals, then they would have a problem with fighting this disease. In fact, one of the things that cancer cells does is that it produces a free radical wall around itself. And we're going to look at that a little later. And by doing that, it blocks the white cell from destroying them. Free radicals also affect your stem cell. Your stem cell are your original cells. You do maintain some of that, and that is give you the ability to repair organs. So let us say you had a damage to your liver, you can use a stem cell to form new liver cells and therefore repair that damage. But if there's a lot of free radicals in the area, the stem cell is unable to work, and as a damage will persist, and therefore the disease it causes will persist. For instance, if you have diabetes due to damage to the pancreas. The only way you're going to reverse that disease, you would have to get your stem cell build new pancreatic cells. But then if there are free radicals in high concentration in the pancreas, the stem cell is not able to work, and therefore you will have your diabetes will not be able to reverse. Okay, so why is DISMUTATIon inadequate? Why is it that we have this ability to remove these free radicals, but we are not doing so? And as I said earlier, these particles come from water, and therefore if we destroy water, we destroy our ability to repair ourselves, to fight disease, and all the DISMUTATIon, lack of disease, the consequence of that. Now, how do we destroy water? Chlorination is one of the ways we destroy water. Well, the chlorine that is used in the treatment of water reacts with a number of these particles. And if you react with the particles can no longer function as they were designed to function. In order for chlorine to work in the water must be acidified. And many of these particles are unstable in an acid environment. This is why you hear people talk about an alkaline water, natural water being alkaline. Yes, natural water is alkaline, and the reason why it is alkaline is to keep these particles stable. So the moment you have changed the stability of these particles, you are now changing the water composition, and therefore you are interfering with dismutation in your body. We have compounded that by filtration, and especially the reverse osmosis filtration. You'll probably see it very popular in some supermarket where they say they're going to filter out all the particles. Well, what you're doing, you're filtering out the particles that protects you from free radical damage. Another important thing we do is adding sulfur to the air, or sulphuration of the air. Most of the sulfur in the air currently is from human activity. Now, when you see lightning and all this activity going on in the cloud, what you're actually seeing is a manufacturing process going on. That is the first stage in the manufacturing of drinking water. The lightning helps the nitrogen in the air to react with the oxygen to form nitric acid, which comes down with the rain and reacts with the soil to form a number of compounds. If you have high sulfur in the air, sulfur will also react with the oxygen when there's lightning and form sulphuric acid. So now you have two acids coming down, sulphuric acid and nitric acid. Sulphuric acid is a much stronger acid than nitric acid, and it will compete with nitric acid and disturb the whole process of the formation of drinking water. To add to that, now we also have the contamination of the soil. So again, many of the reactions that we are expecting to occur in the soil no longer are occurring, and therefore affects the water quality. So basically, water has been destroyed, and therefore we no longer have the ability to remove our oxidants in an efficient way, and these oxidants now leads to disease or prevent us from healing. All right, so what has been the clinical experience since we started to add these dismutation catalysts? And we are seeing benefits in all areas. We are seeing benefits in where white cell function is involved. We are seeing benefits where stem cell functions are involved. In fact, we are seeing a consistent response independent of the disease with increased cure rate with consistent use of the immunogizer. Conditions like rheumatoid arthritis, lupus, cancers, menstrual disorders, hypertension, Alzheimer's, which we weren't seeing improving before, we're now seeing that, and even multiple sclerosis. Okay, I just want to look at two examples of how the dismutation process helps various conditions. I'm going to look at cancer and also viruses. Now, you probably heard I've said before, I often say that glucose, cancers love sugar. And if you have a patient with or a person who has cancer, you should try and reduce their sugar. Now, I'm going to try to show you that actually that is a very bad advice, especially if you have your dismutation system working. Now, this red object here represents a cancer in someone's brain. Now, notice there are some plus signs around. What these plus signs are referring to are free radicals. What the cancer will do, it will manufacture a lot of free radicals and create what we call a free radical wall. Why it is doing that? It knows that once it has that free radical wall, your white cell, which is represented by these yellow objects, is unable to penetrate the wall. Now, notice if you were present in last week's presentation, we said the white cells immune system are boosted by the intestinal bacteria. So even though the white cell may be boosted by the intestinal bacteria, they cannot attack this cancer because this cancer has a solid free radical wall. Now, if your dismutation system is working, the dismutation system, the nanoparticles will remove these free radicals and transport them, as I said before, into the adipose tissue or your fat tissue. In the fat tissue, particles will now convert these free radicals into hydrogen peroxide. Now, hydrogen peroxide, once it is formed, will follow blood sugar. Anywhere sugar goes, hydrogen peroxide will follow it. So if the system is working, the sugar will take the hydrogen peroxide into the cancer cell. Yes, cancer cell does use sugar at a higher level than normal cell. In fact, it uses sugar 20 times faster than normal cells. But if your dismutation system is working, the sugar now becomes a bait. In other words, once the cancer begins to consume the sugar, it's going to get the hydrogen peroxide with it. Now, while hydrogen peroxide is not that toxic to your regular cells, it is very toxic to cancer cell because cancer cell does not have the enzyme to break down hydrogen peroxide. In fact, once a cancer cell absorbs the hydrogen peroxide, many of these white cells, now that the barrier is removed by the dismutation process, will inject things like iron into the cancer cell, because once iron gets into the cancer cell with the hydrogen peroxide, it's going to change it into the hydroxyl ion. Remember we mentioned one of these very toxic free radical, and therefore kill the cancer cell. So in order to kill cancer, not only do you need a good immune system, but you also require a dismutation system. Because without the dismutation system, you can't remove this wall. And the dismutation system gives you the added advantage of poisoning the cancer by attaching the peroxide to the blood sugar. So many times when I have patients with cancer, I tell them that we want them to consume sugar. They think it sounds ridiculous, but it's because prior to starting immunogizer, they were not having adequate dismutation. So in that case, obviously sugar would be negative. But once you have dismutation, the sugar becomes a positive element. The other example I want to give is the example with viruses. How dismutation is very important with viruses. And I brought that in because we all seeing the COVID crisis that is going on. Now, this is representing your kidneys. As remember, we mentioned earlier that kidneys is one of the structures that helps to remove the excess hydrogen peroxide. Now, kidneys is designed with these tubules. The yellow represents a tubule, and there are millions of these tubules inside your kidney, and they are connected together, and as the urine is formed, it's collected in what we call a collecting duct, and obviously goes into your bladder. Now, the blood vessels goes into these kidney tubules at the top, where you have this capsule we call the Bowman's capsule, and forms a network. What you'll find, the blood vessel going in is much larger than the blood vessel coming out, and that's where it's not shown in the picture here, but the blood vessel coming out is much smaller. As a result, pressure would build up in the system here, causes stuff from the blood to be filtered into the tubule. This green arrow here is representing things being filtered. But because the tubules have very small holes, only small particles like viruses, water molecules, hydrogen peroxide, salt will be filtered. The larger particles like blood cells, protein will not be filtered and will continue through the other limb coming out of the capsule. Now, as the filtrate moves down the tube, many of the components are reabsorbed, including viruses. Viruses are very small, and they'll be reabsorbed and re-enter the blood system, right? Here they return to the blood, as is pointed out in the diagram. Now, it's very important you understand that when you get a virus, let's say you got a COVID infection, and you have the COVID enter one of your mucous membranes in your mouth or your eyes or so. In order for that COVID virus to spread to your lung, it has to pass through the blood. And it takes a virus about 2 hours passing through your blood before it can be attached to tissues in your lung. Now, every 5 minutes, your entire blood passes through your kidneys. So it means that the virus will pass through your kidney about 12 times per hour. So it will pass your kidney roughly about 20 to 30 times before it attaches to a cell in your lung and begins to multiply. Now, the particles from the water sets up actually an electrical field inside the kidney. So as the stuff is reabsorbed, remember we said it's filtered and then some of the stuff is reabsorbed, it has to pass through this electrical field before it can reabsorb into the tubules. Now, because you have this electrical field which is formed by minerals from water, this electrical field will break down the hydrogen peroxide back into hydroxyl radicals. These are very toxic radicals we mentioned earlier. Now, if the COVID virus is passing through the field, the hydroxyl radical will destroy the COVID viruses. So in fact, we are built with a system to prevent what is happening in the COVID epidemic and so on. And one of the reasons why you're seeing it is destroying older people more than younger persons, because the COVID virus is one of those viruses that generate a lot of free radicals. What they call the cytokine storm is a condition that generates a lot of free radicals. So if you already, free radical levels are already saturated because you weren't going through DISMUTATION on an active basis, they are more prone to the COVID virus. And this is one of the reasons why younger persons are less vulnerable than older persons. So in fact, there's a system designed in the kidney to prevent this virus from multiplying as it passes through the kidney each time. Now, we discovered that back in 2018 when they had the dengue outbreak. During the dengue outbreak, we saw patients coming in who had dengue and were not showing the same signs and symptoms as other persons. For instance, there were a number of cases we saw where persons in their family would have dengue and they would become very sick with fever and the usual other symptoms. But those who were taking immunogizer or the Jamunogizer did not have any symptoms. We had a number of cases also who developed what we call hemorrhagic dengue. Hemorrhagic dengue is a condition where the dengue begins to affect your bone marrow and your platelet levels drop to dangerous level and you can bleed to death. And we had two interesting cases in doing that. One person actually was in the hospital, in children's hospital, and the child just kept bleeding and the doctors had actually given up. Well, to our surprise, the patient mother came to us and asked us if the immunogizer would have helped, and we said yes. She was able to convince the doctors to use it or to use it on her child. And within 24 hours, the child was out of hemorrhagic dengue and was discharged a few days later. We also had a patient coming in with hemorrhagic dengue and we gave the product to, and within 24 hours, the person was well. We had some patients also who had confirmed acute dengue, and all they were complaining of was a little itching in the nose. So we know that the system is working very effectively against viral infections. We have had some experience with COVID, but unfortunately we're not able to confirm if they were COVID. They had the symptoms of COVID. So far we have seen 10 persons who have called in with symptoms who refused to go to the hospital, and we were able to treat them with the immunogizer. One of the things we added to the immunogizer was peptobismol. You might wonder why we add peptobismol to it. The system in the kidney requires a compound called bismuth, but the level in the immunogizer is at the level that you should normally present in natural water, and it takes you about 6 months to develop sufficient levels for this electrical system to be established. Now, Pepto-Bismol has a high dose of bismuth in it, so we were able to use that so we could rapidly develop the kidney electrical system, and therefore these persons were able to remove the COVID in very short time. We add a little fruit juice, because the fruit juice helped to break down the Pepto-Bismol. So we had a little formula we have told them, which is to use the immunogizer with Pepto-Bismol fruit juice, and just take that twice a day. And most patients were better within 24, 48 hours. And this included patients who were up to even 84 years old who had comorbidities, and some of the comorbidities we have there was obesity, diabetes, renal failure, and hypertension. So in summary, what we have said in the last 3 weeks, we looked at the biblical principles for diet, and we said, one, the pattern on eating is very important, and that's the sabbatical diet. You must eat heavy 6 morning and fast 1 morning, and that ensures you get maximum repair and slowing of your aging process. We also point out that prebiotics are very important, and wine is the ultimate prebiotic, and it maximizes your immune system. And now we are looking at DISMUTATION catalyst supplementation, which is designed to remove metabolic toxins. So we are, in fact, fearfully and wonderfully made, but because of the destruction of our food and water, we are not experiencing that on a global basis. I turn it back to you now, Wayne.
Okay, thank you very much, Dr. Robinson. And that's an amazing presentation. When we think that God has made us in such an amazing way, and man has destroyed us by doing certain things to our water and also to our food. It's really a very serious situation. But the reality is that the immunogizer provides some of the remedies in order to reverse, what has been lost in water and what has been done to the foods. Now, I just want to welcome our brother Gladstone, who has joined us in home. I don't know, Gladstone, if you want to just lead us through the question and answer section, or you want me to do that? Or you want to make any comments before we go into the questions? Let me just on.
Okay, yes, thank you very much. Yeah, I think it would be best for you to go ahead and take us through the questions. Okay. But Dr. Robinson was very informative.
Yes.
I mean, yes. we know just generally that water is very important because they say the body is, if you were to break down the body to its simplest form, it's like 80% water. We know that all begins in water. So, but for you to be giving us this detailed exposition on the properties of water and the value of these properties for maintaining our health is very helpful to us. So I want to say thank you very much.
Okay.
And so time we want to allow those who are on the line, I know they have a lot of questions and the time is very limited. So let's go ahead and hear your questions. Thank you.
Okay. Let me just go to the chat session now. And I have a question here from Stacy from Jamaica. And Stacy says, I'm doing a 10-day cleanse. Can I take the product during the cleanse?
What you mean by a cleanse? Is it like taking something to wash out, what we call in Jamaica a wash out?
I believe it's that kind of cleanse.
Okay. All right. Yes, you can take the immunogizer with the cleanse. One of the things that I've tried to tell persons is that it's not so much your body, your bowel that need the cleansing, but it's the food. Most of the foods we have a lot of preservatives in it, and the preservatives not balanced out with prebiotic. Natural food has both preservatives and prebiotic. And when you don't have a balance between preservative and prebiotic, you get a lot of bad bacteria growing. So it's really the food that really needs the correction, is really in the food. Once you correct the prebiotic preservative ratio, then you get quality bacteria growth, a good flora, and that, as we said earlier, would boost your immune system. So not you can't take it with the cleanse, but it's really the food that needs to be purified. Not so much the bowels that needs to be purified, it's more the food.
Yes. And Dr. Robinson, I think I've always heard you say that, these kind of cleanses are not really good because it also cleanses and removes the good bacteria that is necessary. So
yes, that is true. It does remove the good bacteria. What they'll do sometimes, they'll give you probiotics to take after the cleanse, on the assumption that it will replace the good bacteria. But the thing about the bacteria is that bacteria has knowledge of your past experience, right? There's interaction going between the bacteria in your colon and your white cell, and how you have been handling diseases and so on. There's memory within those bacteria. Now, if you wash out those bacteria, you have lost that memory. Because even though you replace it with good bacteria, those good bacteria has no contact with you in the past, and so on. The natural process is one where the bacteria continues to divide, so it retains that memory. So even though you pass your stool and you lose a lot of that bacteria, you retain bacteria that has the memory of with the problems you have had in the medical problems you have had in the past, so that they can inform the white cell how to handle problems if the same problem returns.
Okay, thank you, Dr. Robinson. Okay, there's a question from Keisha. If you bathe with chlorine water every day for years, what are the short-term and long-term effects on the first time skin and secondly the body? So what are the effects on the skin and also secondly the body?
All right, the chlorine reacts with proteins and protein molecules, so it does damage protein, and I mean it gets attached to it and so on. It can damage your skin, and some of the dermatologists sometimes recommend that you try and use water that has low chlorine level. Yeah. But the damage to the skin is very minimal. The real damage is really with chlorine is that it removes the particles in water which your body requires for proper dismutation. And as we pointed out, if dismutation is not done well in your body, you are guaranteed to get sickness, because your body can only contain 10 years of the free radicals that it produces each day. So you have to have a process that is constantly removing them. And this is why disease tends to start after 10. In fact, there is a molecule we measure in the blood called uric acid. And uric acid goes up whenever the free radicals are being leached into your blood. And uric acid is normal in children up to 10. After 10, that's when we see it start to rise. So we know that that's when the capacity of the body has been reached. Obviously, some people rise later because they probably had their children on better diet. But you only have 10 years capacity. And therefore, once that has been breached, you are guaranteed to get sickness in some form.
Okay, thank you, Dr. Robinson. Okay, and Angel says, good evening. How do I clear my sinuses?
All right, sinuses, a number of things can cause sinus problems. Often it's due to allergens, exposed to various allergens, whether or not it may be natural allergens like in flowers, or it may be due to man-made allergens like smoke and such. Now, obviously, you can get secondary to that. Now you can get an infection, so you can get an infection, sinusitis. If you have an infection, normally doctor will give you an antibiotic which helps to clear the infection, but that will not get rid of the causative factor, which is the allergens and so on. You really need to have your white cell working very well, and as we pointed out in the second lecture, that the bacteria in your bowel helps to improve your white cell function, and therefore allows your body to adjust its immune system so as to prevent these allergens from triggering off these inflammatory reaction in the sinus. So the immunogizer will help mainly from the prebiotic point of view in preventing sinusitis.
Okay, thank you. And from Sandra, Anna, good evening. How can immunogizer help to repair an overactive thyroid?
Okay.
And I guess you could also address the underactive thyroid to doctor.
Oh, okay. All right. Overactive thyroid is believed to be caused by an antigen, and it's sometimes referred to as a long-acting thyroid stimulating antigen. So no one has been able to identify where this antigen comes from. My view is that I think it's coming from the bowel, and it's probably coming from some bad bacteria. So this bad bacteria produces this long-acting stimulating thyroid factor, which goes to the thyroid gland and trigger off the thyroid gland to become overactive. Now, if you had a proper flora, in the sense that your flora had good bacteria, which results from taking prebiotics, then this bacteria that is generating the LATS would not survive, and therefore your thyroid would return to normal function. We have seen that many times in the clinic. People come with thyroid problems, sometimes even severe form, what they call it, Graves' disease is a severe form named after a gentleman named Graves. And once they go on the immunogizer, usually after about 6 months, we can reduce their medication that they are using for the thyroid disorder. Low thyroid function is different. It's really due to virus attacking the thyroid. It's very much like with a cold. In the sense, a cold, when you have a flu, the virus is attacking your lungs. In the case of low thyroid function, the virus is attacking your thyroid gland. So again, if your immune system is good, if your DISMUTATION system is good, the virus would not get a chance to survive in your body to damage the thyroid gland. Because we point out in the DISMUTATION system that the kidney uses the hydrogen peroxide to kill viruses as they are reabsorbed into the kidney after the filtration process.
Okay, thank you, Dr. Robinson. This one is from Judith Senior. Can I take stem cell for one cancer? Can I take it for bone cancer? Can I take it for all forms of cancer? You know, we can extend, you know.
Okay. All right. The stem cell, what the stem cell is doing in terms of improving cancer outcome is one, its role in DISMUTATION, and two, its role in boosting the white cell. Last week we dealt with boosting the white cell, and what we said then is that the white cell is interacting through the appendix with the bacteria that resides in the appendix. Let us say, again, using the picture on the screen, we have the cancer in the brain. What would happen is that you have what they call helper white cell that would take samples of this cancer, bring it down, take it down to the intestine and expose it to the bacteria. The bacteria will react to it and produce products we call plasmid. This is what is represented by this purple ribbon in these yellow cells. Those purple ribbon is information how the white cell can kill the cancer. So your body is able to generate programs to kill cancer. But that is just half of the solution, because as I pointed out in today's lecture, is that if the white cell now begins to attack the cancer, but the cancer has created a free radical wall, there's no way at all the white cell can pass that wall. That wall has to be removed, and this is where a DISMUTATION system comes in now. So if you don't have the particles to remove the wall, then the white cell can't do the job that they have been trained to do. But in addition to removing the wall, the system also creates its own chemo. So your body actually makes its own chemo, and your body chemo is hydrogen peroxide. And it is very specific because only cells that consume high levels of sugar will be affected, because the hydrogen peroxide, as we said, will attach to the blood sugar. And when the cancers consume the blood sugar, they don't realize they're also consuming the poison. And the white cell can activate the hydrogen peroxide to be even more lethal by injecting iron molecules into the cancer cell, which will cause the hydrogen peroxide to become even more toxic, or what we call the hydroxyl free radical form. So it's a systematic approach, and it doesn't matter what cancer you have, whether it's brain cancer, bone cancer, breast cancer, pancreatic cancer. The same system will apply in all cases.
Okay, thank you. We already spoke about sinus problems. This person is asking about acid reflux.
Okay. Acid reflux is a stomach esophageal problem. That is when acid from your stomach is re-entering your esophagus, and that's the tube carrying the food from the mouth to your stomach. Now, normally there's a valve between the esophagus and the stomach, and that valve can be damaged from various reasons. One of the commonest reasons for it to be damaged is that the parts of the stomach gets into the chest, and you see it most often in persons who are overweight, because there's increased pressure in the belly, and it causes the esophagus to pull the stomach into the respiratory system and damage the valve in the process. As a result, now acid can enter the esophagus. Now, once acid enters there, that's a reflux process. It can come all the way back up to your mouth, and you can sometimes taste it in your mouth. And obviously it causes burning of the esophagus, because the esophagus is not designed to tolerate high acid levels. Obviously, what you don't want the person to lose weight, if that is the cause, if weight is the cause, the doctor might recommend that you shift your position in your bed, that you put your bed in an incline, you put your head at a higher level than your feet. That will prevent reflux as such. Again, you're going to need a stem cell here. The stem cell will be very important to repair the damage of the valve that was messed up by being pulled into the chest. So your stem cell will be very important there. The doctor would most likely put you on some medication to reduce the acidity in the stomach. That will give you a lot of short-term relief. But to really fix the problem, again, your diet will be very important, eating heavy, fasting one, and your stem cell working to restructure the anatomy there.
Okay. All right, the next question. I'm a diabetic of 15 years on tablets. How can this condition be reversed?
All right. Diabetes. Diabetes is one of the most difficult conditions to reverse. And the reason for that is that it is associated with a free radical damage, right? And to add to that, your glucose is a key molecule in the whole repair process. So it's not a very simple process. But again, you'd have to follow the three principles. One is eating and fasting. That's very important, because if you're eating and fasting as recommended, it will give your body a chance to change parts. Because you really need a new pancreas. That's what you really need, a new pancreas. The body has the ability to make a new pancreas. It has the information and it has the necessary cells to do it, right? Remember, your body made the pancreas from one cell. You started with one cell, and that one cell built all your parts, and that is your stem cell. But your stem cell cannot rebuild your pancreas if the pancreas is loaded with free radicals. So you have to be removing those free radicals. And as I said, diabetes is a condition where it's a high level of free radicals. So it's going to take some time to reverse that. We are seeing diabetics improve. And depending on how long they have it, they have the diabetes, because the longer you have the diabetes, the more free radical damage you have. But once you eat the food, do your fasting, take the immunogizer, and keep removing those free radicals. Little by little, your body will restructure the pancreas. And once it is restructured, your beta cells will start producing sufficient insulin again, and your medication would reduce over time and stop. We have had patients who have reversed, but it's not as simple, especially if you have diabetes for a very long time.
Okay, thank you, doctor. Okay, there are two questions about fibroids, and a question also about, can I take immunogizer every day? Well, I can answer that. But yeah, immunogizer is recommended to be taken every day because, of course, the food that you're eating daily, has all the toxins, and also the water that we're drinking, has all the important things removed from it. So, I mean, that's really something that is recommended. Doctor, can you talk about the fibroids?
Right. Okay. No. Why the uterus is producing fibroids is because it's trying to dilute the free radical. Remember I told you that the cells have a capacity, a free radical capacity. And once it passes that free capacity, which is 10 years, the free radicals will now be released into the tissue, and it's going to cause damage. So what the uterus is trying to do is to dilute it, and that's why it's making the fibroids. By making this extension, it's able to dilute the free radical that is accumulating, and therefore reduce the toxicity. But as we know, once it starts to do that, you're going to get a lot of problems such as bleeding disorders, painful periods, etc. And obviously it can affect fertility and give you problems with pregnancy as such. Now, the removal of the free radical is key to reverse the fibroid problem. Because once you begin to remove the free radicals, as we pointed out earlier, the uterus now will remodel itself, right? So the capacity for the uterus to go in either direction is there. It's in its program. All the cells in the uterus have the program there. It's just that it's trying to reduce the toxicity, because the free radicals, as I said to you, is going to damage the tissue and could lead to cancer and other more serious problems. So the whole process of fibroid formation is a way to reduce the toxicity by diluting the level of free radicals there. Obviously, this leads to hormonal dysfunction and so on. So once you start to remove the free radicals, the uterus will do its own remodeling. You don't have to remove the fibroids surgically. And persons who have removed it surgically will tell you that after 2-3 years they come back again, because they have not addressed the primary problem. The problem is free radicals, too much free radicals.
Okay, thank you, Dr. Robinson. We have 5 minutes to wrap up, guys. Let's see if we can run through these questions very quickly. I have myasthenia gravis. What is your recommendation to fix it?
Okay, myasthenia gravis is would come under what we call the autoimmune diseases. So it would overlap with things like lupus, rheumatoid arthritis, etc. Now, what we think is happening in the case of myasthenia gravis is, again, we think there is bad antigens being formed in the bowel, okay? When you have bad bacteria produces, all bacteria produces antigens, but bad bacteria is going to produce antigens that are negative to the system. Now, these antigens will attach themselves to various structures. In the case of arthritis, it will attach to the joints and so on. In the case of myasthenia gravis, it's attaching to the muscles. And as a result, attaching to the muscles is trigger off inflammation of the muscles, and the person's muscle become dysfunctional and they become very weak, especially after using the muscle for a while. So what you really want to do is to get a proper flora back into the bowel. In other words, that's where the prebiotics become very important. Because once you get the prebiotics and it enhances the good bacteria, it is going to suppress the bad bacteria. Once you suppress the bad bacteria, then these antigens that are coming in and tagging the muscles will be reduced, and the inflammation that it generates in the muscle will also be reduced, and the muscle function will gradually return. Obviously, you might have to take some medication for a while to improve the strength of the muscle, because this can cause extreme weakness. But over time, as you restructure your flora, the problem will reverse.
Okay, thank you, doctor. All right, and can immunogizer be taken with blood pressure medication?
Oh yes, immunogizer can be taken with any medication. What immunogizer contains are natural products that you would have received if you're in a normal environment, natural environment. You're no longer in a natural environment. You're in an environment that is very toxic, as we said. For instance, the water you drink is not; it's very destroyed. The food that you eat has excessive amount of preservative. If you're in a natural environment, you would be getting a balance between the preservative and prebiotic, and you will be getting all the dismutation particles in natural water. So it's not a drug. It's things that you wouldn't normally get. And as you pointed earlier, Wayne, that this is something you take every day, because if you're in a natural world, this is what you'll be taking in every day. And because we're not getting it, this is why the dysfunctions have crept in, and as I just pointed out, the disease profile is getting worse.
Yes, yes. Okay, thank you, Dr. Robinson. Now, someone is asking about getting a good night's sleep. I'm over 50.
Okay, right. We did point out that the importance of prebiotics, and medicine have done a lot of work on prebiotic. If you notice, on your left, bad sleep is one of the causes of poor bacteria function. And this is a short list of some of the things that your bacteria does. Last week we pointed out that the human body is not, physical body is not only human, but it's human and bacteria. And we are what we call a symbiotic creature. The bacteria that lives inside of you is 10 times more in numbers than your cells. And therefore you can't eat food just for yourself. You have to eat food for the bacteria also. But then if you are eating food that contain a lot of preservatives, then what you're doing, you're destroying the bacteria. Now, the bacteria is producing a number of products that is being absorbed into your body and helps various function. As we may point out, one of the functions it does help is sleep.
Yes.
So if the bacteria is destroyed, then what it does to help you with sleep is lost. And therefore, bad sleep is a consequence of that. So you can't ignore the bacteria. Now, the way you get the bacteria healthy again is by taking prebiotics. And as I said to you, a lot of studies has been done worldwide on the use of prebiotics. Prebiotics now is becoming a commonplace. Even the children milk now, most of the Nestle's products are coming down with prebiotic. The main difference between our prebiotic and what Nestle's use, we use a prebiotic combination that we find in wine. And we think that is the best combination, because it's addressing a number of things, while the prebiotic you get in, say, Nestle's it only helps 1 or 2 bacteria, but it's not as broad spectrum as what you find in natural wine, or we said wine 2,000 years ago.
Yes, yes. All right, there are questions here about can stem cell help with menopausal problems? Mm-hmm. And also, if someone is to do a DNC, should they stop using the stem cell for a while and start right after the surgery?
Okay, first, remind the first question again?
Yeah, the first question is, does it help with menopausal problems?
All right, a lot of our problems is because the body is unable to do its own adjustments. If you have your free radicals under control, if you have your bacteria very healthy, if you are eating and fasting and your cycles are stabilized, then as you go into menopause, you won't find that problems that we are seeing very often today, right? Your body is designed to do a lot for itself, but it was designed to live in a certain environment. We have changed the environment, and because we have changed the environment, especially with food and water, what the body is capable of doing is not capable of doing that anymore. So the transition from one stage to the next stage, we see the same problem as girls now starting up their period. Now you get a lot of problems with that. We also see the problem with menopause as you move from into that stage. We also see dysfunction occurring. But once you're on proper diet, once your bacteria are fed properly and you're removing your free radicals, the system will work very well. Okay. The second point you mentioned about DNC, well, the problem would be doing a DNC. DNC is done for a number of reasons. Most often nowadays we do DNC to assess for cancer. We see it a lot. Older women who may be having bleeding disorder, especially after menopause, they will do a DNC. And one of the reasons why they're doing it is they're looking to see if there's any evidence of cancer there. So, well, you would want to be on your immunogizer because whether or not there's cancer there or not, the body will know once it can and deal with it once it's able to remove its free radicals. So DNC is not a reason to stop it.
Yes, yes. All right. Unfortunately, we have to close now, and I'm going to hand over to Pastor Gladstone. But just to let you know that if your question was not answered today, next week, Thursday, we're going to have a segment called Ask Your Doctor, which will be about 30 to 35 minutes. And so any question that didn't get answered today can be answered next week. Okay, so thank you once again. And I'm just handing over now to Pastor Johnson.
Okay, yes. Thank you. Okay, I just want to say to everyone that on the link that we sent you, we gave you access to the websites that you can to purchase the products if you're interested in doing so. And then we're also available to you to answer any other questions you have. And we want some feedback. We need you to tell us, what do you think about these sessions? And if you think we should continue them, please go ahead and text us or on the chat. Let us know, give us the feedback so we know where to go. Or if there are some other subjects that you'd like Dr. Robinson to cover, we'll be happy to do so. So again, I want to thank you for tuning in. We'll be on again next week, and then we will know if we should continue based on the feedback you give us. Thanks again. See you next week.